Treatment. Persons with the plague need immediate treatment. If treatment is not received within 24 hours of when the first symptoms occurred, death may be unavoidable. Antibiotics are used to treat plague. Oxygen, intravenous fluids, and respiratory support are usually also prescribed. Patients with pneumonic plague are strictly isolated from other patients. People who have had contact with anyone infected by pneumonic plague are observed closely and are given antibiotics as a preventive measure. Without treatment, about 50% of those with bubonic plague die. Almost all persons with pneumonic plague die if not treated. Treatment reduces the death rate to 5%. Plague Family Guide to Home Care. An intentional release of plague will result in many people being hospitalized within a few days. This information may help. If you or any member of your family has any of the following symptoms, go to the nearest hospital or treatment center now. High fever, headache, weakness, shortness of breath, chest pain, cough that may bring up blood, or rapidly developing pneumonia. If you have been exposed or suspect exposure to plague, go now to a public health dispensing site for preventive care. Stay away from those who are sick. Avoid as much as possible people or animals who are sick. Patients with the disease should be isolated and medically supervised for at least the first 72 hours of antibiotic treatment. Use everyday sanitation techniques. Plague is a serious health threat that is very contagious. Using common sense sanitation techniques can lessen your chance of exposure. Wash hands frequently, especially after eating or drinking, after using the bathroom facilities, and before and after every contact with those who are sick. Use hand sanitizers in absence of hand washing facilities. Wash hands after every contact with animals. Use a solution of 1 part household bleach to 9 parts water, or standard hospital-grade disinfectant for cleaning surfaces. Leave on for 30 minutes. Disinfect bathroom and kitchen areas daily. Where to get more information. Stay tuned to local media for ongoing updates. Centers for Disease Control and Prevention Public Response Hotline. Phone numbers are 888 246 2675 for English. 888 246 2857 for Spanish. And 888 874 2646 for TTY.